Hi, my name is Dr. Dirk van der Spey and I'm an orthopedic hand surgeon practicing in the southern suburbs of Cape Town. Welcome to Cape Hand Surgery. Cubital tunnel is a compression neuropathy of the ulnar nerve. The most common compression neuropathy is carpal tunnel syndrome, where the median nerve is compressed, and the median nerve is more a sensory nerve where the symptoms has got more related to sensation on the radial side of the hand. Cubital tunnel involves the ulnar nerve with the compression in a tunnel behind or posterior to the medial epicondyle of the elbow. Now, the ulnar nerve essentially is referred to as the powerhouse of the hand, mainly because it supplies the small intrinsic muscles of the hand, giving you the ability to have a grip strength. So the symptoms are typically more power related or weakness, with the sensory symptoms being essentially pins and needles on mainly the little finger and part of the ring finger. So it's therefore patients would typically present with pain around the elbow, but also with sensory symptoms going down to the hand. Now, when we look considering the ulnar nerve's anatomy, when we bend the elbow, the funny bone or the medial epicondyle have a tunnel just behind it where the nerve runs. The ulnar nerve comes from posterior, it goes through the intermuscular septum, and it goes approximately 2 centimeters proximal to here. It dives into the cubital tunnel, which is anatomical fibrofascial tunnel where the nerve runs through. It then comes out round about here, and then it dives into the muscle belly of flexor carpi ulnaris. Now, typically, as the nerve appears at this level, we will get an irritation of the nerve, and when we do a Tinel's test, the patient will experience electrical sensation going down the hand all the way into the little finger and ring finger. Now, when we look at the hand, the symptoms usually is more on the ulnar side, and also the patient will, when we test for the intrinsics, they will be weakened than compared to the other side. And sometimes we'll also get the typical wasting in the first web space when the muscles are fading. Now, the treatment for cubital tunnel syndrome is essentially we try and treat it conservatively first. However, this is very much a compression neuropathy caused by anatomical structure, therefore there's very little that we can do. In the flex position, patients experience more symptoms because the pressure in the tunnel is higher, and therefore when we sleep in the fetal position, patients typically feel more symptoms during the night. So therefore the therapist can make an extension splint during the night that prevents people from flexing it. But ultimately, if there's motor loss and the pain becomes intractable around the elbow, we need to do a surgical intervention where we go and release the cubital tunnel. Now, what we can see here is this is the elbow, there's the medial epicondyle, and there runs the nerve in the tunnel that is already released. The ulnar nerve is substantially smaller than the median nerve. Here we can clearly see just before this is the cubital tunnel, and just before it dives into the cubital tunnel, we identify it before it dives into the tunnel so that we can under vision release this tunnel. This is a picture of a complete release cubital tunnel, and what we can see here is the nerve is completely released. So the tunnel is opened, and here it dives into the muscle belly of the flexor carpi ulnaris, and that is nicely open and free. Afterwards, we put a little fatty flap over it to cover it with fat, because that will prevent scarring and the patient would be able to mobilize nicely without the nerve jumping out. So in essence, if you experience any elbow pain with some symptoms on the little finger side of your hand, cubital tunnel is a condition that you probably should have checked out, and we would be happy to help you with this problem. Thanks for watching. And please feel free to visit the website at www.capehandsurgery.co.za or follow us on Instagram or Facebook.